planning, and ideally not all at the same time. But so such is our life right now. With our the vaccine part of our response, we have been able to secure clinic venues for Tuesday through Saturday of this particular week, Wednesday through Friday of last week, and then the week before when we met last, we had Wednesday through Saturday. The clinics have been at a variety of venues, including churches, community centers, and support locations for the LGBTQ population, focused with Coachella Valley Volunteers in Medicine and our other street medicine teams for homeless outreach, as well as in partnership with several of our CBOs, like TODEC in the Coachella Valley. These clinics continue to support walk-in capability as well as prior registration. We have continued to be somewhat challenged, though thankfully it's improving with being able to secure venues and avoiding last-minute cancellations. It had become a common theme of challenge around venue securing and the associated logistics to have clinics fall through. That has not been the case this most recent week, I'm grateful to say. And we have been able to run a clinic today with Our Lady of Guadalupe in Palm Springs to support a homeless outreach event, as well as community outreach event that centers on support, social services support. We have a clinic tomorrow, similar theme, with Weston Park in Hemet, working with the church and charities system, both Catholic and Jewish family services in the Hemet area to support homeless outreach, as well as social services and food distribution. We'll offer Jynneos vaccination and additional support. We have a clinic with the LGBTQ Community Center in Palm Springs on Thursday. We will be at Our Lady of Soledad in Coachella on Friday, and then Saturday at Cathedral City Boys Club, supporting one of the pool party events for Leather Pride. Leading into next week, we have partnered with DAP Health and IEHP, as well as our HIV STD branch within the Public Health Department, to offer vaccine with the Pride events along the Pride schedule, setting up clinics approximately an hour before the events of the day are supposed to start, except for Sunday. Sunday, we're starting right at 10 when the parade is, because of access, parking, and staff support. We'll be able to vaccinate all 3 days of Pride there. And we also have events being confirmed in the days prior to Pride, including, again, churches, community centers, and other CBO partnerships. We've had successful clinics with Desert Water Agency and have begun additional conversations with other non-healthcare employers in the Coachella Valley to offer Jynneos support. And we have requested and received an additional 800 vials of vaccine to supplement our inventory leading into Pride and Leather Pride, with an additional order pending to support those events. We did request staffing support from CDPH to aid in scope and scale of operation and to support our logistics. That request was approved, and staff have been onboarding since Friday in a couple of cohorts, the most recent and last cohort finishing up today. Those staff will support the scope and scale of operations both on Saturday at Leather Pride, as well as in-home vaccination for post-exposure PrEP, which we are post-exposure management, which is PEP. We will continue to be doing those efforts as we have been since the response started. And we have also worked with the Brothers of the Desert to support their wellness summit in partnership with DAP Health for 11/12, and we'll be at the Palm Springs Air Museum running an event on 11/9. I know that those events are a little bit further out, but wanted to make sure that I previewed those. We have made a couple of flyer adaptations. Dr. C, if you're in a position, would be great if you could share those for me. I'm not in a position with internet bandwidth to be able to do that. But those flyer adaptations kind of piggyback off of what some of our CBOs and Desert Water Agency have done as options with making an announcement of the clinic, date, time, and address logistics, as well as the links for registration on that announcement style flyer. And then on the additional flyer, we have worked with trying to provide examples of how an individual may fit into the eligibility criteria, giving examples around gay, bisexual, same gender loving, and transgender and non-binary sexual activity. So a non-binary person who has one or more anonymous partners, or a non-binary person who has one or more sexual partners, a same gender loving individual who has one or more sexual partners as examples. The flyers are,
I could
Dr.
show
C.
those flyers. Yeah, I was going to say perhaps once you're done with your report, we can pause and I can show those flyers and then show the rest of the data too. So I'm not showing it while you're talking right now, just so that way I can scroll through and talk people through it.
Thank you. Okay, and let's see, I think the other piece.
Misty, you muted yourself. And just so you know, some questions in the chat, because you might not be able to see that. Some questions about how many vaccines have been given out per week, or with these different clinics, or the average number of vaccinated at various events. And I know the answer is it varies, but perhaps you can give some context of that, Misty.
Okay, thank you, Dr. C. So we've given, as a public health department, 2,057 total doses of vaccine. The vaccine amounts vary, as Dr. C highlighted, by space, time, staff at each particular clinic. I would say that the county's average as a whole across all of our providers is between 900 and 1,000 doses a week. That covers all of the providers from the west end of the county to the easternmost part of the county in Indio. And the public health department fills in gaps around where the clinic providers are physically headquartered. The CDPH staff that are coming on board will make an additional team of 10 individuals that will supplement our teams, so that we can support from the parking lot of CCBC for the Leather Pride event. And we will have the capacity there to give as many doses of vaccine as we're able to give during the operational hours. We have planned for at least 1,000 with the ability to cushion and support with courier service if additional are needed during the operational hours of the clinic. Palm Springs Pride, we're aiming for 6,000 doses of vaccine. That's to supplement the providers that are already operating on Friday 11/4 during their standard clinic hours, and will adjust as operationally needed and partner with others to maximize vaccine supply. And let's see, what else did I not miss? Or did I skip from the chat? Did I get everything that you asked? Oh, and the flyers that went along with clinics for tomorrow. IT is currently working to post up the clinics for tomorrow. We shifted flyer templates to navigate the requests that came from this group. And so getting the flyers navigated and through has taken our time the first part of the week, so that we could get the events posted. But we have circulated the information for the clinic through the CBOs in the Hemet Pass area that are focused on homeless outreach and support of the LGBT Q population and the risk population so that they are aware of the event. And I would imagine ideally within the next hour or so, if not as quickly thereafter, that those clinics will be posted. What else did I skip, Dr. C?
Um, I I think you've covered the most of it. There is a comment about some of the clinics have been booked up, or they say that there's no appointments. And just to share, for all of those clinics, there are also walk-in availability too. So we have the combination. So the reason that you might not see every couple minutes available to schedule is because we want to make sure that we leave room for both the ability to have scheduled appointments as well as walk-in capability. So that's responding to one of the questions.
And
And
a
then
quick question about that, a follow-up. Does it say that on the website? So when people go there and can't make an appointment, do they think they're SOL, or does it say, walk-ins will be accepted?
It says that on the website above the list of clinics, as I recall from our draft verbiage, that walk-ins will be accepted as able, and the flyers note that as well.
Okay, because I think a lot of people go to the website for their information, and I don't know if they'll see that at the top of the page when they're navigating the appointment part.
So it says it, and I can share my screen and show this part too, to show where it says. So maybe we'll switch over to my part. I'll start with that part, and then I'll go through the other parts of the report. So let me share my screen. All right, here we go. So this is, are you able to see my screen?
Yes.
So this is the one where you're able to book appointments. So here in yellow, this is where we have it boxed. Walk-ins are welcome, but can't be guaranteed as they depend on vaccine supply. So for all of these, that would be the case, is that walk-ins are still welcome, but they can't necessarily be guaranteed. And then I can also show how we show it on our flyers as well. But we did try and have it in both places to make that that clear. So I will show flyers, and then I have some data and some other things that I will show as well. So this is updated flyer template, and this is just an example for one of the clinics that we have upcoming. And as you'll see, this eligibility component has been translated out of medicalese. So we have a man who is sexually active with one or more men, a gay man who is sexually active with one or more partners, a same gender loving man who is sexually active with one or more partners, a bisexual man who is sexually active with one or more partners, a transgender woman or transgender man who is sexually active with one or more partners, as well as a non-binary person who is sexually active with one or more partners. And then if people still have questions about whether or not they're eligible, we do have a phone number here that they can call to discuss eligibility. We also, if in case they have trouble making an appointment, whether they're not able to access the link or the code, we have a specific scheduling line that people can make appointments through the scheduling line. They can help them through. And then if they have other questions, we also have our MPX email. So this is one flyer, and then we also have one that's more pared down. We're using both. The second one is just more of a clean, has an image, and it just says MPX vaccine clinic. They both say first and second doses, so you can see that. So that way that's clear. We just have the location, address, and date. Again, ability to schedule the appointment from here. Walk-ins will be accepted as able. Both flyers say that too. So walk-ins accepted as able. And then this, again, gives the ability to follow up more for vaccine criteria, to email, to schedule. And again, if any of this, is difficult to navigate, we also have the website that they can go to for scheduling for themselves. So those are the updated flyers. But then I also wanted to share, so for instance, in working with some different groups, we'll use Desert Water Agency as an example, they've also created their own flyers that work for them, or their own graphics. So for instance, this was from the first, one of these is from the first, one is from the second. I think this is from the second clinic that they had. They created their own graphic, vaccine clinic monkeypox, and the timing and the location with an image of their choosing. And this is a second example. This is from their first clinic that they had with us, where they did a graphic. And so we similarly are encouraging organizations and groups to help with putting together their own images, flyers, or graphics that they feel might cater better or target to their populations. But in addition to, now we have these as well. And then I'm just going to share a couple of other things. So I'm going to go over some data. Today we're reporting 0 new cases, and over the past around week and a half or so, we've had just about a handful of cases. And so you can see this on the epi curve as well. Over here, you see that, pretty consistent drop off. When we look at the epi curve, we also pair that with wastewater data too that we look at, because that helps us give us an idea for even those who aren't testing necessarily and might find presence in the wastewater. So fortunately in Palm Springs, we do have a site that's doing that. The latest count that we have from October 17th was 0 viral copies, which is again a good sign. But as we've been continuing to I put the messaging out, with Palm Springs Pride coming up, with Leather Pride, we know that we'll have an influx of people coming in, 50,000 potentially, maybe more people that might be coming into our county. And those individuals may or may not be vaccinated, may or may not be carrying MPX with them, which is why, again, we try and protect as much of the community that we have with a combination of vaccination and discussion of harm reduction strategies. Here we have our dashboard. So again, 0 cases today that were reported. Similar breakdowns as you have seen throughout. And our vaccine dashboard, and Misty did go over some of our latest vaccine data. This is updated on Thursdays. So as of this past Thursday, we have the 16,896 doses given within our county. And then I wanted to show a couple of other things. This has the clinic locations, but what I was originally going to show was that we do have, of course, some updated flyers, so you can take a look at those. And then there are some other flyers that I wanted to particularly point out that we have links to CDPH and CDC on the bottom, but some that I wanted to call out as Pride is upcoming. So there's some graphics about, when you get home from Pride, what you should be, considering to do. There's also this flyer on social gatherings and know before you go. And they talk about social gatherings, things that are safer versus higher risk, highest risk, with the highest risk being events in enclosed spaces like back rooms, saunas, sex clubs, or private public sex parties, where intimate, often anonymous sexual contact with multiple partners occurs. So those have the higher likelihood of spreading MPX. So this is potentially a helpful flyer. And then this is one from CDPH, which talks about safer sex and MPX and talks through some of those harm reduction suggestions, like avoiding sharing items and cleaning items. So wanted to point those out as well. So that is where I will pause for now. And let me see, I may have missed some questions in the chat. Okay, congrats on plain language.
Yeah, a common theme. We're happy to finally see
I'm
that.
gonna stop
Thank you.
sharing my screen.
So, somebody asked, what's your assessment of the timeliness of these large scale Pride vaccinations in terms of actually protecting people and preventing new cases? Of course, that's the big concern, right? So
yeah. And so I don't, and this is what we've been saying all along, I don't consider the vaccines at Pride, at Leather Pride, at Palm Springs Pride, those aren't the ones where we're talking about protecting the community prior to Pride or for Pride. And so it's important for all of us to know, people that are attending the events, and for us as the community and community leaders to share the messaging. If you're vaccinated at Pride, that does not mean you will be protected for Pride. Vaccination and full protection to the maximum that we can get happens when you get 2 doses plus the 2 weeks out. And that's why we've been vaccinating all along. And in addition, the other part is, even if you are fully vaccinated, that doesn't give you 100% protection against MPX. Max, you get around 80 some odd % protection. And that's because any vaccine, no vaccine is 100%. So the best that we are going to be able to do for all of us is when we combine the protection of vaccination with harm reduction practices, meaning thinking about ways that we can reduce our risk, reduce our exposure to MPX. So if you have MPX, you have a rash, staying home so you don't expose other people. asking partners about whether or not they might have a rash that they haven't had checked out, reduction of anonymous sex, as an example, might also help with harm reduction. Thinking about, closed indoor spaces and the opportunity for skin to skin contact when using sex toys, cleaning those sex toys, cleaning outfits, with Leather Pride coming up. So thinking about all of those things and our opportunities to reduce the harm through the combination of vaccination and as well the harm reduction practices. And then also I can say with the vaccination efforts at Leather Pride and Palm Springs Pride, the reason behind those is because that's when large groups of people are going to be coming out. So it gives us the ability to provide protection to large groups of people where we know that they're going to be. But we certainly don't want to give the false sense that that's going to protect them for those Pride events. It will help them with protection going on in the future. But all of this work that we've been doing since the start of the, vaccines becoming available and all of the community partnership and the messaging, that's really what's going to, line us up in a better position as Pride comes. But no matter what we do in terms of vaccines, there's always going to be that opportunity or the possibility for MPX to spread at an event, because we have a large number of people that are coming in from a place where vaccine either may not have been as accessible, or people might have chosen not to get vaccinated, or even if they did, they might have the MPX rash and they're coming in and they're celebrating among our community.
Yeah.
So
Well, that's why there was so much frustration that there didn't seem to be a more concerted effort to do large scale vaccination events in the 6 weeks, 4 weeks, and 2 weeks prior to Pride.
Well, I
and
can
now
say
it's, we are where we are, but it's,
Yeah.
it's unfortunate.
Well, I think that, I want to say that there has been vaccination, not only 6 weeks, 4 weeks, and 2 weeks, but all the way along through. And that as public health, we have to work with partners. We cannot work alone, which means that we have to be partnering with Eisenhower and DAP and Desert Oasis and, Riverside Medical Clinic and all of these other clinics and our CHCs, because we cannot do it alone. There are a lot of people that need to get vaccinated, and that means that we have to engage our other partners in order to be able to have that, that reach that we need to have.
Well, I know a number of them had reached out and offered to do that, and they weren't asked to, didn't take them up on those offers. So, we are where we are, but there's a couple of questions about messaging at Pride. You mentioned that people aren't going to be protected when they get, is that going to be very explicitly told to people? Are there going to be large posters and so forth, educating people about that at Pride? Because like you say, that's a huge event. That's a real opportunity to educate
There
people.
will certainly be messaging. We're going to be having all of our flyers, but we also have education for our nurses that will be vaccinating. So they'll be able to share that messaging for people as they're getting vaccinated, to let them know that that protection doesn't happen right when they get the vaccine. And that's part of our typical education process, letting people know when the protection is intended to would come into play after they get vaccinated. But I do want to say, throughout time, as we've been able to partner, part of the challenge is, a number of clinical facilities are not necessarily they're not able to vaccinate outside of their space, which has limited their abilities to be able to come out on certain events on the weekends. But we have, consistently been vaccinating for the number of weeks prior. And I think that is evidenced by the success that we also see now throughout our community, with the levels as low as they are. With that said, we all need to be practicing precaution. We all know that there's going to be a large group of people, and that therefore we need to make sure our community is aware of that potential risk. And that's going to happen through a combination, again, of, we have some people and large groups that are vaccinated, but we also might have people that are not. And the combination of vaccine and harm reduction is the only way that we're going to be able to protect as many people as we can.
So in terms of, you got some pretty impressive numbers countywide, but I'm looking at the numbers for Palm Springs, Cathedral City. It's 5,200 for Palm Springs, about almost 1,700 for Cathedral City, and what is Rancho Mirage? About 685. So those aren't impressive numbers. So somebody had asked in the chat, what do you think the level of protection is in our community with those kind of levels? Because this is a town of 45,000 more this time of year, of whom probably half are gay men, if not more. So that's way short of the mark. So we wanted to get your take. Are there hidden numbers in there that we're not aware of?
Well, so I think that there's a couple things to realize in that. And that number one, these are vaccines that have been entered into the care system. So there's gaps in that, meaning if somebody was vaccinated outside of the care system, that will not be represented in the data. And we know that there were some people that early on, prior to vaccines being more widely available in our area, that they did go to, other either towns, cities, states, or perhaps in some situations countries where they got their vaccine. That would not be reflected in this care data. There are other areas, regional areas, where they do not use the same system, and so therefore this is the at least this many people are vaccinated, but there are more people that are not within the care system that would not show up within the data that we have. So I think that that is a good point. I think the other part is when we are trying to understand how well protected or how vaccinated our community is. We've all along had discussed the challenges around denominator data. It's really hard to know how many people are at risk, because though we are seeing higher numbers in gay males, for instance, it is not just being gay itself is not what puts you at risk for MPX. It's the close skin to skin contact. And that's why we've also seen people within other communities as well get MPX. Kids in other areas too. It's the skin to skin contact. So it's knowing, the risk that can come from, that skin to skin contact. Again, why we talk about the harm reduction as well. Hard to know what behaviors and that combination to help us to figure out denominator data. That's also why we've been making all along really targeted efforts to work with, sex workers, individuals that are the homeless populations, individuals that otherwise might be trading whether food or goods or other things for sex. Those are individuals that we know are at higher risk of likely coming into MPX. And we had really strong campaigns and efforts since the beginning to vaccinate that population on top of, broader vaccine efforts. So I think our data is clear that we've been bringing down the numbers of MPX in the community. But of course, we all hope that we can get more and more people vaccinated over time, and that we're clear about the risk of potentially getting MPX at any of these upcoming events.
Okay, thank you. So there's a couple of questions and comments. Bob notes that the new poster that the web address takes you to an appointment reservation. No, it doesn't take you to the appointment reservation page, but instead that you have to create an application for the My Health account and doesn't lead to a sign-in page for making appointments. Is that possible to be corrected? Because one of the things we've been hearing in the community is that people find that whole process kind of daunting and evasive. They don't want to give their personal information. So a lot of people are opting not to do that and waiting to hear about walk-in clinics where they can be more anonymous.
Yeah. So the website he's talking about is not to sign up for the vaccine interest form. He's talking about the upcoming vaccine clinic. So you would get the link to the upcoming vaccine clinics, and then you would click on the place where you want to have the appointment for. I think his question is about why doesn't it go specifically to the scheduling link? And that's because the scheduling link itself is quite long. And so we do have the link that you can click to get there. But if you're not able to access the link, then you have a couple of other choices or options. So if you can't access the link by clicking on it or by using the QR code, you can go to the shorter link, which is one that we can control, which is the upcoming vaccine clinic link. Or if any of those are difficult, you can also call to schedule for an appointment. So those are the different options. Now, there might be other creative things that as community partners might think about doing. So for instance, if you're trying to help advertise that from the community, one thing that you might do is copy that link and put it into the tiny URL. Now, us as a government agency may not be able to use tiny URL as a way to spread, share that information, but community partners might consider other ways that they might be able to do that.
Is there a reason you can't use Bitly or tiny URL?
I suppose I might need to request some help from my social media or policy growers to help. Yeah. But I think it's mainly because it's not secure government sites, and that the appearance of that when it's coming from tiny URL may not appear as a government resource. It doesn't appear as secure, and that other people could create something that looks similar.
Huh, okay.
Dr.
I see a hand.
Dr.
Go ahead.
I'm sorry. I want to let you know that is the reason why a lot of entities will not use it, because it doesn't have a URL or a identifiable lettering on it, so they won't click on it. And also, our IT does not like us using it either.
Okay. Bob, you had a question or comment. Go ahead. Got to you got to mute yourself.
Thank you. The question I posted, it's referring to the new poster that you put up at the beginning of your conversation. As far as I could see, it omits the line at the bottom that gave the web address in print for ruhealth.org/upcoming-vaccine-clinics.
So I'm happy to re-show that. I'm pretty sure we do have that on both of the versions. So on this first version, we do have that here. So you have that upcoming vaccine clinics.
Wait, you have it where? I'm sorry.
I'll highlight it. So right here on the bottom, to view all upcoming clinics. So it's right here. And then on our second flyer, the one that's more stripped down, we do have that here at the bottom to view all upcoming. So we do have that on both.
Okay, of those two, just the fact that I looked at it and missed it the first time, the one on your second with the bottle is easier to see and read, and it's all in one line, so it's easier to type as compared to being in the earlier version where it's against the purple background and it's on 3 lines, which makes it very difficult for a person to enter. You can't click on that because it's not everyone is receiving it as an active link in a PDF. It may work in yours right now, but as soon as you photocopy that or post it as a JPEG, that's useless. Likewise, the QR code is only usable if you're not on a phone and you can take a picture of a screen with your telephone. But over on the right, where in the purple box above the QR code, schedule an appointment, myruhealth.org. Now, that is very clear as compared to the other address. However, if you go to myruhealth.org, it requires about a 5-minute sign up. You have to be able to confirm with your credit card your credit information, and a lengthy process.
Oh, I'll show when you click on it, this is what comes up. So you select a time.
If you click on it, but people can't click on that.
So if they're not able to click on it, that's why we also have the call line as well. We have a few different options there to be able to navigate through that. So there's an option that you can click on it. There's an option that you can call. There's an option that you can go just to an option that links you to this upcoming MPX. So we try to give as many options as we can, that if one doesn't work, there's 2 or 3 others that you can similarly be able to click on the link and have access to.
All right, let me thank you for all of your efforts. Incidentally, many of the things that are incorporated here are a direct reaction or suggestion that our input to you has been heard. I would say simply on that last point, the line across the bottom is the easiest to type in, which is how people have to do it, rather than going through my chart. Also, I signed up a week ago Sunday with your interest form, and I've not heard a thing since then. And when you go to make an appointment and you do get to the link and you click on 1027 at the LGBTQ Center, it says all of the appointments are gone. Now, if above that, it says appointments are available, walk-ins may be accepted. The likelihood, if you're a logical person, well, if I can't get an appointment, they must be out of vaccine. Why would I go over and run the risk of taking time off work or driving over to stand in line if I don't know that I'll get in? So I'll let it go at that. Thank you.
And I could show again, we say walk-ins are welcome, but cannot be guaranteed. We try to make it as friendly language as we could, but I do understand your point. But at the same time, the balance is, if we say that all walk-ins will be served, the challenge is that, between the hours, we might have a steady flow and we might not be able to get to everybody. So we're trying to be realistic with the time and the ability to vaccinate as many people as we can without providing a false guarantee. But
and just so you know, final point, when I saw that all the appointments were filled, I deleted all of the ads on each of the websites where I had put them. Because for one thing, on Thursday, you only had 1 hour of appointments to begin with that were available as of this week. And I figured, why have people go to the effort if there's no appointments? So it's worrisome.
Yeah.
Thank you.
Thank you. And I appreciate your feedback, and I thank you, because it has been able to help us to make these flyers better and to continue to take down barriers and make things more accessible. So I do appreciate that. And again, it's a tough place with, the appointments at some point. I mean, if we saw a number of appointments still lagging, I think we would have concern to say, well, why is nobody scheduling for appointments? Perhaps we're not advertising enough. And then on the other side, if we see no appointments are left, then we say, well, we wish there were more appointments so people could sign up. But then on the other side is, well, then, are we taking away from the ability for walk-ins? So these are the kinds of calculations and the things that we're thinking through consistently to try and have that right balance. But I think, as you see, oftentimes that is a tough balance that we're having to consider.
So there's been a couple of comments in the chat that people got an email from RUHS today at 4:16. One was for a clinic today that was, I think, already over by then. And then with the clinic, the following clinic, and there were no appointments available. And so these are people who signed up or registered and they haven't really gotten anything since. So they're kind of wondering, what's going on there. The people who did, followed all the directions and signed up should be getting more notices and have gotten access to a clinic and an appointment by now, no?
Well, so we've encouraged people to check back on the website routinely because of those upcoming clinics. We do consistently add more. And in addition to those clinics, we also have seen that our, clinical partners have also been able to take in more, people as well, not only people that are within their network. So that's included DAP and Eisenhower, and we talk about all those other clinics as well. So within that, that different network of clinics, in addition to the vaccines slots that we have, we are consistently getting more and more people in for vaccine. And anybody who has called us, with any challenge of not being able to navigate or having difficulty, we have found them an appointment, whether it's with our CHCs, whether it's asking partners to help us to schedule, or within one of our events. We also have newsletters that have been going out initially every week, now every 2 weeks, and we'll have one that's coming out on Thursday as well. That again will share information about upcoming clinics. So there's continues to be a lot of activity going on for vaccine clinics on the MPX front. And so we do encourage people to check back on those sites. It's a good thing that vaccine appointments are filling up because we want to get people vaccinated. And it just, continues, for us to schedule more and more events and find opportunities for people to get vaccinated.
What's the no-show rate for people who've signed up for appointments? And do you have kind of an estimate of what that would be, or a ballpark?
I'm not sure if Misty's still in the call because I know she had another obligation after 6:30. So that I might have to get back to you in terms of the people that schedule and how many of them don't show up. I don't know that offhand. She probably would.
All right, no worries. I see Daniel Rangel has his hand up. Go ahead.
Yeah, hi, thank you. Yeah, I just had some. So I work with Palm Tree Clinical Research, and I've been speaking with Juanita Irvine And so we're a clinic, or we are a research clinic, and we actually help host the last vaccine location, and we do have 2 more coming up. So the day before, I guess, Pride weekend, the 4th of November and December 12th. So I just want to see if would we be getting a flyer update anytime soon? Because I know when you were posting the flyer, I did the QR code. I clicked, it comes up and it shows me the appointment schedule, but I didn't see our site listed yet for the upcoming clinics. So we have plenty of space. Last vaccinating clinic, out of 100 doses, they were able to give the vaccine to 33 individuals. I think 10 of those were walk-ins. So, I mean, the more advanced notice we can get, because we also work with Dr. Phyllis Ritchie. She has a STI clinic within our same office, and they have patients that have also been asking. So with enough notice, we can reach out to our population and see if they want to get on the schedule or see if they want to walk in. So yeah, I just want to see if
And I think on that note, again, similar to how we've worked with some other, groups that have created their own flyers too. If you'd like to do that for your own patients, you're welcome to. Otherwise, as soon as things, firm up and we get those confirmations, and we're able to, we just finalized our new flyer. I had said no more flyers go out until we have our finalized new version. So now that we have our new version that we, just signed off on, we'll be able to get those together. And then I guess I would also say, once you find out about how your new electronic health record system is going, and if you can get onto care, it would greatly help us if you're able to get onto care. So that way you can vaccinate more regularly in your clinic. And that goes for all clinics, any of them that are able to go onto care. Now that we're switching to more of a demand system, where clinics are able to request vaccines, the more clinics that we get onboarded means the more vaccine that we're able to spread out in the footprint that we're able to have throughout the county.
But we're a little different because we do research. We don't have an EMR, EHR. So we basically provide this location for you folks. You guys bring in your personnel. But yeah, because I looked at the flyer that we were provided and I looked at the QR code, but I think it's no longer active because it was probably just for that date. But yeah, I could definitely update the flyer because I was going to ask if I can list our office number, because it'll be on a Friday, we'll be in office. So that way, if patients want to call to see if there's availability, maybe we can help out, because I don't know how active you guys will be with answering phone calls. I mean, I could potentially help with some of the phone calls and say, well, let me see if they have any walk-ins or any availability, so I can help with that.
Yeah. I appreciate that offer, and we will have walk-in availability. Like I said, we schedule the appointments such that it allows for the ability to take in walk-ins too. So I would say you can start advertising to your own patients. There's no problem with that. And then we'll also have our flyers. Like I said, we just had them signed up today, and so all the future clinics will be upcoming in terms of updating them. But you do not have to wait for our flyers in terms of starting to message to your patients. And you can also let them know that, either you can send out that flyer, when it comes with the actual, appointment link that they can sign up and make an appointment, and also let them know that we'll be taking walk-ins as well.
Yeah, I think that'll be the because we'll promote it and let our contacts know. But yeah, I think it'll be very important to have the flyer with the QR code that they can easily scan, and also hopefully our site shows up on the list, because right now when you pulled up the QR code, I didn't see our clinic on the list, and this is not this Friday but the next Friday, so it's pretty much almost here. So yeah,
we're working through them.
Yeah, I know.
Working through them to try and get them up on the website as soon as possible. I know that the team has been working with you guys to try and firm up and cement the dates and the locations.
Yeah.
And so then after we do that, we work with our website people to get the link and to schedule the appointments. So we have that going on in the back end, and then we put it on our website.
Right.
So you'll be seeing that updated soon.
And then
So
my
Daniel
last
had another question about if at the Pride events at the big vaccination clinics, are they going to be offering other vaccines like COVID and flu?
So we are in planning to also make flu vaccines available. The reason behind that is that we're already seeing signs of flu in our area. And we want to make sure that we can allow some protection out in the community for flu as well. So we are going to be hoping that people can get both the Jynneos and the flu shot at that same time, or for individuals that already have their Jynneos but want to just come for the flu shot, that would be fine too.
But not COVID.
not COVID. And part of the reason behind that is that there are some restriction for men that are under the age of 39 or younger, and potentially spacing it out, and then having to consider the amount of time since their last shot. And so that would slow down the process and would mean that we would be able to give less vaccine in total. So we want it to be a quick, smooth process. There's no contraindication for anybody for flu and the Jynneos. So that's the route we're going.
All right, thank you both.
Yeah, I know a couple of the providers are on, so maybe we could turn to them to see if they have any updates on what they're seeing on the ground in terms of new cases or vaccine availability at their locations. So if either Dr. Stapleton from Eisenhower or Dr. Adams from Kaiser would want to weigh in. Sorry to put you on the spot.
Well, this is Dr. Staples, and I'll be quick because I'm once again driving. I was also at the infectious disease meeting last week, so a little less in contact with what's happening. But as far as I understand it, we continue to have a decline in case numbers.
Great, thank you. That's good news. And then somebody had been asking, it might have been privately, but could you explain how the vaccinations are working now at Eisenhower? Because I don't think you go to your own clinic, your own provider, you're going to the central campus in Rancho Mirage, is that right?
Yes, that's correct. We placed a monkeypox clinic referral through the referral system, and then the person is contacted to come for an appointment through a drive-through.
Great, thank you for that. And that's open to anybody? They don't have to be an Eisenhower patient?
Well, they have to have a registration of some kind in Eisenhower. So as far as I know, it is not open to absolutely everybody, but personally tried to get a few people who are only peripherally, engaged in Eisenhower into the clinic. And as far as I know, they've been successful.
Oh, good.
But they do have to be registered apparently because it's through the EMR. So they have everything's electronic.
Gotcha. Okay, thank you. Appreciate that. And Dr. Adams, what's the situation at Kaiser these days?
Hi, everybody. So we're still vaccinating on Thursdays. Yeah, and our vaccine clinic is pretty busy each week. I think it's slowing down a little bit, but I think we have plenty of vaccine available still. And yeah, cases have slowed down significantly. I don't even know of any recently.
Great. And that's down in Indio, correct? Is that where the clinic is?
Thursdays in Indio.
Okay.
Kaiser Indio. Yes.
All right, thank you.
Sure.
So Daniel suggested in the chat about posting the Vax info on a billboard along 111 or Indian Canyon for those coming into Palm Springs, which would be a great way to advertise what's happening at Pride, so people know about that. Have there been any efforts to do something like that? Because I know, and somebody else has mentioned the state funds, the $41 million. So there, hopefully should be some funds available for these kind of activities and promoting the vaccine availability.
Yeah, thank you. For the billboards, we'll bring that back and think about it and see if that would be possible or if that's likely to get people to actually come to the vaccine, locations at Pride. So we'll take that back to the team and think a little bit more through that. But we have been thinking about other ways that we can advertise. We're in conversations with a couple of different apps to try and get that active during Pride. So we are working on some different kinds of advertising ideas to try and get the population to come to the Jynneos sites. But we'll bring back the idea of the billboards as well. Thank you.
Yeah, I know the idea of using the apps has come up, since we first started talking months ago, right back in June. Where are we with that? Can anybody weigh in on kind of what the progress is on that and what the barriers might be if there are any? I see Robin's hand up. Go ahead, Rob.
So I wanted to address the advertisement for our vaccine clinic, working with the manager that works with Ron DeHart. They had already printed the programs, and for whatever reason, there's been no designator on there for vaccinations. So as soon as I saw that, I reached back out. So they are currently trying to work if they can tap it into their app and how else they can go to push that out. So we have contacted them because, again, a lot of people are going to be focused on their app, going to be focused on the events that are coming through there. So again, in addition to having community engagement, actually walk the street. I walked the street today again. That's what I wanted to do as a senior citizen. I looked really good out there. But so it has to be a multi-layer strategy. So, apps, community engagement. We will have health educators out there next week. We will have health educators actually on the street during Pride from Friday night on to start push them where we want them to. So we are looking at different multi-layers to put into play.
Great. Well, we appreciate your old-fashioned shoe leather epidemiology. That's refreshing to see.
And
Oh, and if you
Robin,
need,
can you remind us where the locations will be during Pride? Will people have to go over to CCBC?
No, sir. So during Pride, what'll happen is we're going to be co-located with the DAP pavilion, and it's right behind, where Lulu's is, the steakhouse right across the street from that. So the pavilion's going to be set up right in co-located with that.
Right.
So at the Kaiser Grill. So very prominent location, one where we have community educators. We've talked to Rainbow Youth Alliance. They're going to help push people where we need to. We have HIV/AIDS. We have a significant amount of community educators that will be out there with flyers and other methods to actually put it out there. I myself will be out there all 3 days. I may even up my game and not only do Shoe Leather Express. My wife has discussed getting me a bicycle, and I would look even better.
Thank
well,
you.
do you need volunteers to help with that, with the pamphleting and the work that you're doing? Because we could reach out to some of the groups we work with and see if they'd be willing to help provide some volunteers.
I'm going to have a tactics meeting tomorrow. Once I get off there, I might be reaching out to you, Jeff, if you don't mind.
That'd be
All right,
great.
thank you, sir.
Absolutely. Thank you.
And then to respond to your question about where we are with the apps. So we've so to give some background, historically the challenge has been that the apps have not allowed, or they've had policies against government advertising or any kind of government related advertising on the apps. That is seeming to shift. We've gotten some prices, we've drafted some ads, so we're in those conversations about trying to get that to go through. I also just want to call, I see what about flyers in individual hotel rooms? I think that's an interesting idea as well. So perhaps, Robin, when we do some of our shoe leather epidemiology, we can provide some of those flyers in the hotels as well. I think that's a great idea.
Yeah, so we do include those. In addition, on Friday night, we actually email flyers and information. I had the TPL staff actually go through very LGBT-centric, staying locations. And we actually made sure we not only emailed it to them, there was phone calls, text, and then again, the old senior citizen way, Shoe Leather Express.
Great. Well, we'll be looking for you. I'm sure there'll be big gay flags associated with that. So we're getting close to the top of the hour. Somebody had also mentioned putting cards at the gay bars, letting people know, where the vaccines will be available.
Well, Jeff, you are just reading my mind. So today, as with every week, I actually walked Arena Street Barracks and a lot of others, and I actually brought little cards that I made that showed where the vaccinations were, what time they were, and that walk-ins were welcome because we were actually running an event to where I could actually sit at the Rough Trade store and throw a rock to where I was having a clinic. So, yep, I was out there doing that too.
Excellent. Well, kudos to you for that. So somebody asked about, monkeypox ads on the various sites. And I know, when I logged in last time to my account that I never hardly ever used, but was curious to what was on there. Something from San Diego popped up. So it was a group there that it was Family Health Centers of San Diego. I can't remember the BHOC or something. So that that's happening. So I'm wondering if
I can also add one of the challenge that has been, and so I see here CDPH has been running ads. So some of these apps they already have programmed areas for large, what they consider large, like metropolitan areas.
Right.
So they've had ads that are for the Los Angeles area or for the San Diego area, for instance. And so what we're working with them is to try and carve out specifically the Palm Springs or Riverside County area for our vaccines, for our advertising. So that's also part of the conversation too, is that they're having to look at what that could look like for their technology. So
Gotcha.
in conversations about that.
Okay. Well, good. I'm glad to hear that's happening. Hopefully it can happen in time for Pride Day. I think that make a huge difference with all the, all the safer sex messages, everything we've been talking about. That's who's going to need it. To just be very blunt, we're going to have a lot of horny gay men coming into town looking to hook up, and they're going to need to get those messages right and left, because safety is not always the top
So
of their
Jeff,
list.
I have a
Uh-huh.
question for you. What if there was I hate to use the word flyer, I really hate that word, flyer or poster. Those are banned words now, up there with the F word. But my team has developed some safer activities for intimacy. And they're quite graphic. I mean, I'm older and that's the way we have to play. I
Yeah.
mean, we can't just dance around this. And sex means a lot of different things on our spectrum. So would it be helpful to have those also out there in terms of the different multi-layered strategies we're using? Because I'm hitting bars and stores and things like
Absolutely.
trade. So, but again, I'm very down and dirty, very clear. There you go. Because again, we have to make it very clear, concise, and in addition to not only general sexual activity, but also for those people that are in the sex worker industry, some things that we wanted to do to reduce their possibility of contracting it also.
Yeah, no, I think anything, as much as you can do in as many different places. And, we can talk about partners, we put it at their booths, in addition to what you're doing on Arenas and the various bars, Barracks, it's a new one, Dick's, I think it's called. But yeah, I think all of the above, because it's crunch time and now's the time to be getting that word out. So thank you for thinking about this. I see Stephen has a hand up.
Yeah, I just want to ask, we have a booth at Pride, as we do at the AIDS Walk, as I know, for example, Daniel has as well. I was wondering, do you have, what would be an ideal printable flyer that we could offer at our booths during Pride?
So I could definitely follow up with you if that works. We have a number of flyers on our website. I know I've been talking with Robin as well about that harm reduction kind of flyer. So that might be an option too. And then the ones that I showed. So let me put the links to those in the chat. I think that these ones are particularly good from CDC and CDPH. In addition to, I mean, we have some local ones, but these ones I think really get to like the gathering and the safer sex components. So let me send those here, and then I'll just put, on our website, you can take a look at all of our different flyers, but I can follow up with you about some specific recommendations.
Yeah, I just figure we've got the stage, we might as well use it as a soapbox.
Yeah.
Definitely.
And a lot of community partners will, so I think that's a great way. Are you going to have a presence at the AIDS Walk this coming weekend?
I think for this weekend, is AIDS Walk on the Saturday?
Yeah, it's the 29th.
Yeah. So we I think our team said that they were going to help with some education to tell people where vaccination is happening. So we have vaccination at CCBC with Leather Pride. So there it will be proximate, but it's not going to be at the walk, but there is vaccination happening there at that day.
If somebody could drop off some flyers, we can make sure that they get distributed to numerous booths there. I think people would be happy to share that information.
Awesome.
So,
Okay.
when you're finished walking, go down to CCBC, get your shot, that sort of thing. I know we're running short on time. We're trying to keep these calls to an hour these days, but somebody had asked, with cases dropping so low, what are the plans for ongoing prevention and vaccination efforts?
Yeah. And I saw that comment, and the question was, is it going to be out of sight, out of mind? It's definitely not out of sight or out of mind. I mean, we have how many thousands of people coming into town? It's very much on top of mind and in sight. But not only that, we're also planning clinics out past Palm Springs Pride, because we know even with the best prevention that we have in place, even with, a population that is mostly vaccinated from our side, from county, or a population that is practicing harm reduction, even with that, knowing the flux of people that are coming in, and some of them might have MPX, there is a likelihood or a possibility that individuals will develop MPX after the Palm Springs event. So we have multiple clinics that are planned to help with additional vaccination, but also post-exposure prophylaxis as needed. We definitely have our contact tracers up and ready if we do find that there's MPX at a particular event or particular location, so that way we can contact those that might have been exposed. So our team is already working on these things to try and having an event. It's not just it's not just the event. And I think, as we've talked about weeks before, it's the prepping for the event before, it's the event as it happens, but then it's also post-event. What do we need to be doing? And the messaging around, and that's, one of the flyers that I put in the chat, or I didn't put that one in the chat, but I can. It's one that CDC has about, now that I'm home from my event, what do I need to be doing? And things like monitoring for symptoms. If you know that you've been exposed, getting post-exposure prophylaxis vaccine, if you haven't already been vaccinated. And so we're trying to make sure that those opportunities will be there. And we're going to be continuing to, from our side internally, have our frequent meetings up through and past Palm Springs Pride to ensure that we're able to be flexible and to be able to respond to whatever might come.
Sorry, thank you for that. I think one thing to think about going forward is, once we get a month past Pride, you're not going to be having vaccine clinics every weekend. Will you be advertising that people can walk into the various RUHS sites and things like that? So people know on an ongoing basis,
Yeah.
they move to the area, how do they get access?
That's a great question. That's actually exactly what we've been working on. So we've been working with the CHCs to try and solidify days that they can have walk-in clinics for full days on an ongoing basis, such that we can say every X day, like you can go and get your vaccine. So we are working on that exactly as an ongoing strategy.
Perfect. Great minds.
Yeah.
Great. Any other burning questions? I want to be respectful of people's time. If not, thank you for the new flyers with the eligibility criteria. This is exactly what we're asking for. So thank you for doing that. And fingers crossed, if there's anything we can do to help with the online advertising and the apps and so forth, please let us know. I don't know, maybe someplace like DAP would have more flexibility if you were to help them with making the ad purchase. Would that be one way to go? Because I know doing anything for the county takes a lot of time, as we've learned.
That's something that we've thought about as well. So we have multiple different, if this doesn't work, then this, if this doesn't work, then this. So we have a few different options sort of laid out along that path.
Great, good. I look forward to opening up my account and getting the cobwebs out and seeing those messages. Terrific. Well, thank you, everybody. I guess we'll stay tuned and we'll see if we need another meeting before Pride or after, kind of see what happens in terms of if there's an uptick in cases or not. Hopefully not, but certainly a possibility. So I guess we'll just wait and see. So thank you, everyone. Have a wonderful evening. Thank you, especially the county folks for working the long day and taking these calls. We appreciate it. And
thanks, Jeff and Stephen.
Thank you.
Thanks, everyone. Bye all.
Thanks, Jose. Thanks, Dr. C.